This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. Lafredo, and this week I'm coming to you from KRMC's Disease Management Clinic. My guest is Dr. Eric Feldman. He is a doctor of pharmacy, and he's just nearing the end of his pharmacy residency here at KRMC. Dr. Feldman, welcome.
Hello, everyone. It's good to be here.
It is good to be here. Thank you I always love coming into the DMC. And I think you may be aware of this, but this has become part of the program here with the pharmacy residency, is that I'm the last stop.
Absolutely. It's one of those things where when we come in, it is told you're going to do a radio show. And it's one of those things that you hear about throughout the year. And then when it gets closer in a year, hey, it's that time where you got to reach out to TG and, you got to figure this out. So definitely.
It delights me. One time a few years back, one of your colleagues said, I heard about this when I was investigating the program, and I thought, that sounds like fun.
Yes.
I was like, are you kidding? Because I didn't expect people to enjoy it. So
you, I would say, are an integral part of the residency.
Oh, come on.
It really is.
Oh, my gosh.
I'm telling you it is.
And that's why you got me these flowers and this chocolate. Thank you so much.
Don't forget the filet mignon and the tuna tartare.
Well, all right. So you are finishing your pharmacy residency, and we are going to talk about antibiotics, what they are and how they work. And before we jump in, I always like to do a little bit of kind of getting to know you with the residents. That's okay with you?
Absolutely.
Let's talk a little bit about you. Where are you from?
So I was originally born in New York, but I grew up in Las Vegas, Nevada, and that's where I completed my bachelor's in biology. And then I went to pharmacy school in Roseman University, located in Henderson.
Yeah, so you've been in this region for a long time then.
Yeah,
right?
I never actually came down to Kingman before my residency. Maybe once as a kid. I went to the Grand Canyon by I never actually visited here as an adult.
No kidding.
Mm-hmm.
Yeah. Okay, well, I am going to ask you how clearly you knew that Kingman existed, but when you were looking around for a residency, how did you discover the program here at KRMC?
Funnily enough, I was looking at programs that were sort of in my area because I've never went off on my own, far from home, away from family. So I still wanted to be within range of coming back and visiting my family. So Kingman was a nice location where I got to really experience living on my own, having my own place, managing everything that, especially doing a residency on top of that. So really helped a lot with my development as a person and an adult. And it was just a great location for me to do that.
Is this what the young folks call adulting?
Yeah. Yeah.
So it's been a good place to do that.
It's been great. It's been great.
I will ask you more about your experience here with the program, but I think first I'd like to know a little bit about what led you to this career path. What was it in your life that piqued your interest in pharmacy?
I was like always one of those stereotypical people where when I was a kid, I was like, oh, I want to be a doctor. I want to work in healthcare and all those types of things. There was always something about science, but specifically more in medicine and anatomy. It was something that I always enjoyed. How do certain things affect the body, how the body functions? I actually have a best friend who I grew up with who is a pharmacist, as well as my sister who are pharmacists, and just kind of hearing things that they did and the education, it always just kind of stuck with me. And I actually worked as a pharmacy technician for a few years, and seeing the way that a pharmacist could present to the public, we're available anytime, and the information that we can give people, the way that we can see that it really helps them and how much they appreciate it, because sometimes for a lot of patients just to see a provider could take a long time, and even when they do, it might be a little bit fast and they might forget to ask them certain questions. And I feel that with pharmacy, we are a pivotal resource to help anywhere we can, and we love it.
We talk quite a bit on the program about the national provider shortage and what that means in terms of patient care. Do you feel like more and more of those questions and kind of fielding those issues can fall back on pharmacists?
Yeah, definitely. Even when I was in school, one of the things that we learn, especially like if you're a pharmacist in a community or retail setting, is what are things to look out for if a patient comes to tell you, like, I've had so-and-so for this many days and it's causing this. We are not experts in diagnosing, but to have an idea, okay, is this something that a patient can manage with something over the counter that I can make a recommendation and feel safe? Or is this something potentially where I think they should go get checked by a provider, either immediately if it's something emergent, or, just make an appointment. This is something that I think you should get checked out rather than managing over the counter.
The pharmacy residency is still an option, right? It's optional, I should say. It's not required. Is that correct?
Yeah, so residency is not a requirement in the field of being a pharmacist. First, you have to become a pharmacist, so you have to graduate with your degree. Residency is a way to try to get almost 3 years worth of experience in 1 year. That's kind of how we almost imagine that within the pharmacy profession, but also it allows you to experience so many different settings, as well as being with so many different providers in medicine, as well as so many different pharmacists. And so what it does is you really lock in for a year. Sometimes you can even do 2 years to specialize in infectious diseases, ICU, ambulatory care. There are so many different types of specialties that pharmacists get into, even pediatrics, oncology, the list goes on, where pharmacists can really get very specialized and make a large impact in their healthcare systems. But yes, especially a residency is optional, but it does get you a lot of experience, which I found is very invaluable, especially in a year. It flies by, and it is just overall beneficial for your education, especially make you more competitive in career, and gives you a lot more options and things that you want to do.
Yeah, it sounds like you got a lot out of the last year.
Oh yeah. I mean, like I said, in between doing internal medicine, being here in the clinic, I was managing diabetes when I started here, doing anticoagulation, then going back in the hospital, being in the ICU, and all these different settings. Even I was working with psychiatry and pain and infectious disease, working with our infectious disease pharmacist and physician. Really, it's like a buffet. So many different things you can choose from to learn.
In your career ahead, will you be working all across the board in all those different disciplines, or is there something in particular that you want to specialize in?
At the moment, I'm not looking to specialize for now. I'm more of a generalist. I can do a little bit of everything. So mostly I'll just be in the hospital, depending on the setting, wherever they need me. What's nice is after doing a residency, we can actually take exams to become board certified. So for me, we have an exam called the BCPS. It's just being a general pharmacotherapy specialist. Once I get that exam, then I can say I'm a specialist in pretty much a little bit of everything. So again, a generalist. A little bit down the line, I would like to take the BCIDP, which is the infectious disease pharmacist exam, but that's in a little bit of time.
In your year of residency, you went to the buffet, you got to try a little bit of everything. Mm-hmm. Tell me something that you learned that you didn't expect to learn.
One of the biggest things that I have learned throughout residency, and I think it really is the goal of a residency, is to build upon your critical thinking and to make you comfortable with complex situations. So, for example, when you go to school, you get a question and the answer is always A, B, C, or D, or maybe all of them or none of them. It's always that. And even like in medicine, you get a patient case and your answer is always there and there's always an answer. When you actually work in medicine, sometimes we get very complicated cases where, depending on a patient, how many different factors they have, sometimes there's not a right answer. Maybe there are multiple right answers with very limited evidence. And it's one of those things where you have to be able to look at all the evidence and really come up with your best answer. And sometimes even then, like, your answer could only be based on maybe 5 or 10 studies, but say, you know what? This is what I found. This is probably going to be the best solution. There's not a great solution, but this is going to be the best. It'll be effective. It'll be safe for the patient. And this is what I would recommend to do that case. And really, that I feel is the biggest thing that I have learned and developed through my residency, is really to utilize my resources to empower my critical thinking and be more confident in a lot of my answers to those types of ordeals.
You have 31 days left in your residency.
Mm-hmm.
So it's maybe a little premature, but congratulations.
Thank you.
And what happens next? What's the next step in your career?
Next for me is I'm happy that, I will be staying on here at KRMC. So I will be a clinical pharmacist at the hospital. So I'm very happy to have experienced this residency, be trained by so many great providers and pharmacists throughout my year here, and to officially be a colleague to them. I still tell them all the time, I will still be at their coattails asking questions, trying to pick their brain for a lot of things. But yeah, I'm happy to be staying on and be here in Kingman.
Well, congratulations. It sounds like we might have the chance to speak with you again.
Perhaps. I hope so. I hope so.
If you're just joining us, this is Focus on Your Health. I'm TG Lafredo, and this week on the program, I'm speaking with Dr. Eric Feldman. He is a doctor of pharmacy. He's got 1 month left in his pharmacy residency here at KRMC. And as he just told us, he'll be sticking around, so that's good news. And I think, Dr. Feldman, we should probably move on to our antibiotics presentation so that we make sure we get through that today.
Let's do it.
So thank you for sharing that stuff. I love to hear about folks just starting their careers and what brought them here. It always interests me. All right, so I have a presentation here. It is all yours. Antibiotics, How Tiny Pills Battle Big Germs. What is a good place to start? We should probably start with some definitions, right?
Mm-hmm. What I really start with here are kind of explaining what are bacteria, because everyone talks about bacteria, and I think it has a little bit of a negative stigma to it because, to really understand what they are, you have to know that they're super, super tiny. They're living organisms just like us. And really, they're everywhere in nature and every surface. They are inside of our body and outside of our body, especially your skin. Acne is one common condition that's caused by bacteria on your skin. So it's things like that where bacteria are all around us and they have a lot of different important functions. For example, you have good bacteria in your body, like in your gut, that help with the digestion and process of food, while you have bad bacteria that are the ones that cause infections like your pneumonia, urinary tract infections, skin infections, and so on. Then another thing I go into is kind of defining antibiotics. Just as the name implies, antibiotics will try to eliminate bacteria, and they only work on bacteria. They don't work on viruses like the common cold and the flu. And really what they will try to do is they'll either try to target and eliminate the bad bacteria or try to prevent them from growing and making more copies. Penicillin was our first antibiotic, and that was from bacteriologist Alexander Fleming in 1928. And even though we don't use penicillin itself as much, we use drugs that we made from penicillin still to this day, 95 years later.
Mm-hmm. Do the good and bad bacteria, can they coexist or do they fight it out?
Absolutely. They do definitely coexist. And sometimes, a lot of the time, bacteria in our body have what we call a biome, which is kind of like their own little living space. And yeah, they definitely will kind of stay together. And sometimes your good bacteria will try to sweep them away.
Okay. All right. What are antibiotics most commonly used for?
So usually the most common uses for antibiotics are going to be your urinary tract infection, pneumonias, which are infection of your lungs, cellulitis, which is a infection of your skin, otitis media, which is the fancy medical term for having an infection in your ear, as well as strep throat, which is when you have a sore throat, and fever, as well as sometimes swollen lymph nodes.
And I know from speaking over the years with several pharmacists just how important it is to follow those directions when it comes to taking your antibiotics.
Most definitely. A lot of the times, and something that I stress with a lot of patients if I'm ever talking to the community, is to really ask their pharmacist a lot of questions about medications that they pick up, especially antibiotics, because as we'll get into, a lot of them have their own niche characteristics. A lot of times people say, take this with food. Well, yeah, you'd be right probably 90% of the time, but there are ones that sometimes work better when you don't take them with food. Sometimes there are some antibiotics where taking it with foods high in calcium or other minerals can actually make them work less effectively. Mm-hmm. So that's not always your answer, especially to know, if I'm taking an antibiotic, how will it affect my other medications, So those are questions that I challenge people to ask your pharmacist when you're picking them up. If I miss a dose, what do I do? Everyone has a hectic day, and you got to know always what you do in those situations.
Mm-hmm. And sometimes you may have, for example, a 5-day course, right? And by day 3, you're feeling well, and you say, I probably don't need those last 2 days.
Yeah, most definitely that is something you don't want to do. If you're feeling better when you're on antibiotics, great, they're working, but it's always best to finish out that course because bacteria, being a living organism, they learn. And so sometimes if you take an antibiotic course for less than what you were prescribed by your provider, you might get rid of some of the bad bacteria that are causing your infection, but if there are some that are still lingering about, they can actually learn over time how to overcome that antibiotic. And that can be a concern when we talk about antibiotic resistance.
Antibiotics come in many different classes as well, right?
Absolutely. So as I mentioned prior, our first antibiotic was penicillin. And since then, our most commonly used antibiotics pretty much work in the same way that penicillin does. So from that, we have very common medications like amoxicillin. Then you have amoxicillin with clavulanic acid, or as its brand name is commonly known as Augmentin. Then there's spin-offs of those called cephalosporins, where we have medications like cephalexin, which is commonly used for skin infections. There's another one called Cefdinir, which is commonly used for pneumonias and urinary tract infections. And even from there, the list goes on, where we have a lot of different medications, such as macrolides, which is the most commonly known one is azithromycin, like you mentioned. It is famously known for being a 5-day course of antibiotic where you get in a little box called a Z-Pack. You take 2 pills the first day, and then you take 1 pill every day after. And there's so many others that are also have all their different classes. They work in different ways. They work differently in different parts of the body, and they work on different bacteria. So really you have to tailor what antibiotic you're going to use for your patient depending on the infection and a lot of patient-specific factors. Like we even look at how well the kidney is working, sometimes age, weight, and depending, like as I mentioned before, where the infection is, where the antibiotic will work best.
This is also why you, as a pharmacist, want to know what those patients are taking in terms of medication, other drugs, all the way down to daily vitamins, right?
Absolutely. As I mentioned, there are some antibiotics such as fluoroquinolones. So commonly used ones are going to be ciprofloxacin, and then there's levofloxacin. Then we have other medications like tetracyclines, which are commonly known as doxycycline and minocycline. Those are some of those where vitamins can actually make them not work as efficiently, as well as high calcium foods, things like milk. So those are ones that I look out for where I want to make sure that those are avoided with certain foods and vitamins. And especially some of the other antibiotics commonly used like Cefdinir, a lot of its cousin antibiotics in the same class aren't really special in regards to food or vitamins, but it sticks out where it's best to take it without vitamins as well.
It's important in many cases for patients to be their own best advocates, to know what they're taking, to know what their conditions are. And so I was thinking what we could do is kind of dig in on one of these groups and talk about some of the ways in which they function, the side effects. This is sort of an analogy for how, whatever medication you're taking, whatever antibiotic you're taking, you would want to dig in and learn these things, right?
Mm-hmm. Absolutely. And I completely agree where I like when patients advocate for themselves, and especially you can get a lot of good information out of patients who advocate for themselves, such as, like I mentioned before, what medications they're taking, if they have any prior allergies, any actually really pertinent medical information I usually get out of those patients, and I love it.
Speak up, because then you can help to heal yourself and get better sooner, right?
Right. So one of the groups of antibiotics that I really talk about is the cephalosporin group. What is in that group are some of that I talked about before, where you have cephalexin or Keflex, which is, again, commonly used for your skin soft tissue infections, cellulitis, things of that nature. Then you have a lot of other ones, such as Cefdinir, you have cefuroxime, the list goes on. There really is a lot of them, but what they're commonly known by is if they start with that Ceph, either CEF or CEPH, and that's why they're called the cephalosporins. What's nice about them is they are almost like our more common form of penicillin. They work in the same way, but structurally they're different. So it's like having two models from a car company. The make is the same, but the models are different, if that makes sense. So they do the same thing. They get you to point A and point B, but they look different. And what's really cool about them is that even though they are related to penicillin, one of the great things as pharmacists that we know is that they only have about a 5% or less similarity to penicillin. So when you have a lot of patients who actually have penicillin allergies, whether it be very severe or something as just having a rash, if you give them something like this, there's less than a 5% chance of them having any type of reaction similar to that. Although with a lot of these antibiotics, especially cephalosporins, usually they will cause upset stomach, sometimes some nausea, sometimes some rash. And that's why it's always good to ask your pharmacist, ask your provider, again, do I take this with food? Because a lot of times the food is what helps prevent upset stomach, preventing nausea and vomiting, things like that. So that's why it's always good to ask questions, especially if I'm on something. Again, what do I avoid? What should I take? When I miss a dose, when should I make it up? How long do I take this for? They're all great questions to ask.
I guess as a caveat, we should say this is really a crash course in antibiotics for the radio, given our time constraints. So there's more to be said about that. So ask your pharmacist, right?
Absolutely.
But I would like to touch on probiotics. What are they?
So one of the things that I touched on in my presentation, because I spent a lot of time talking about bacteria and antibiotics, and one of the questions that I see all the time is, are probiotics good for me? And should I take them while I'm on antibiotics? It's a very controversial question with a lot of mixed answers. And honestly, you can't really go wrong either way. So essentially, when we look at probiotics, there are some of the examples of good bacteria that can really help in our body. And most commonly, we see probiotics that are used for the gut. And a lot of the times we see strains called lactobacillus, and that's what's going to help with a lot of digestion and to make sure that everything in our gut is working well. So one of the conflicting things with taking a probiotic while you're on an antibiotic is that an antibiotic can't differentiate between good and bad bacteria. Once it starts going to work, it's going to work. And I see a lot of patients get recommended to take a probiotic while they're taking an antibiotic to help prevent a lot of those stomach side effects such as nausea, vomiting, and sometimes diarrhea. The problem with that is if you're taking a probiotic while you're on an antibiotic, that antibiotic can actually wipe out the probiotic as well. And that is the dilemma and the theory with that situation. So then I'll see a lot of providers also recommend probiotics after receiving an antibiotic, which is on the camp that I kind of lean on because it makes more sense. And so, probiotics are good. There's a lot of evidence for them. There's a lot of evidence saying they might not work. It really depends, but there's not a lot of negatives to them. And with a lot of my patients, I always recommend getting the most affordable because some of them can actually be pretty expensive. I always recommend getting a probiotic that has a lot of different strains of bacteria. And how you can do that is if you look on the package, when you see the big, fancy, long bacterial names, if you see 3 or 4 different names, those are usually the ones you want to go with because they have a good variety of probiotic in them.
In the moment that we have left, let's summarize with some key takeaway points.
So pretty much takeaway points from my presentation here is that antibiotics are generally safe and they're incredibly commonly used medications. There are many different antibiotics and they can be used for many reasons with different doses, dosing, and as well as for how long you will take them. Asking your pharmacist questions about antibiotics you are receiving can help mitigate some side effects and ensure the efficacy of your medications, whether it be the antibiotic or some of your other prescription medications. Completing that full course of your antibiotics as prescribed, even if you begin to feel better, very important. And if you experience serious side effects or allergic reactions, inform your prescriber as soon as possible.
That is Dr. Eric Feldman. He's a doctor of pharmacy, and he's just completing his pharmacy residency here at KRMC. He's also sticking around, so there's a good chance you'll run into him at KRMC. Dr. Feldman, thank you so much for your time today.
Thank you so much for coming out here and taking the time to interview me. It was a pleasure. Thank you so much.
And that is the program. That's Focus on Your Health. Thanks so much for listening. Stay healthy, and we'll catch you next time.